All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. Welcome to BMC Global Live Al Hilal Health World, nothing but lifestyle. Influenza or flu is a common viral infection affecting our nose, throat and lungs, which are parts of our respiratory system. Most people with flu or influenza may recover by themselves, but in some cases this may lead to complications. To speak authentically about this condition, we have with us Dr. Adarsh Udayan from Al Hilal Hospital, Hamad town. He is a specialist pediatrician with an experience of more than 10 years. Doctor, welcome to the show and thank you for joining us today.
Thank you for inviting me to the talk show. Thank you.
It's our pleasure. So doctor, today our topic of discussion is influenza. So what is influenza and what are the causes behind it?
Influenza, as we usually call flu, is a common respiratory illness, acute respiratory illness in children. It is caused by, its symptoms are fever, as you all know, may be aware of it, everybody aware of it, everyone knows about it. Fever, coughing, sore throat and cold, common cold, etc. It is usually caused by the influenza virus. Influenza viruses A, B and C. In humans, influenza A and B are the main culprits, and it occurs in the temperate climates, and it is usually seen in the winter months starting from October to March. It spreads via coughing. I told you, the contact with the sick children, coughing, sneezing, and it aerosol spread These are the main methods of spreading the virus. So, it is usually uncomplicated illness, but in some children it may lead to complications, severe morbidity and mortality.
Now, doctor, can you explain about the risks associated with influenza in children?
As I told you earlier, it is an acute self-limited respiratory illness in children. But in some children with the immunodeficient states, with chronic illnesses like cerebral palsy, neurodevelopmental disorders, blood problems, blood diseases, and kidney or renal transplant patients, and immunodeficiency, by birth, severe congenital immunodeficiency states, primary immunodeficiency states, and etc. For these children, this influenza virus can cause serious damage, serious complications like pneumonia, otitis media, and meningitis, encephalitis, seizures, etc. They require usually hospitalization and further management.
So, now you described about some of the complications. Can you make it more clear about the complications of influenza in children?
Yes, influenza in children usually a self-limited disease, but I told you earlier, it's in immunodeficiencies. If the child is not immunocompetent, sometimes by birth or sometimes by getting illnesses after birth, or sometimes with asthma, chronic asthma patients, neurodevelopmental features, cerebral palsy, etc. For these type of children, they have already a chronic disease. They are immunodeficient, most probably immunodeficients. So, these patients can have a flu, which can lead to later complications, severe complications, morbidity, mortality, or even some complications like pneumonia. It exacerbates the presenting problems itself, that is asthma, illnesses, chronic illnesses, that the flu itself it exacerbates the existing complications. So, it can lead to hospitalization and further morbidity and mortality problems.
So, when should we visit a doctor with when the child is having flu? We know it's not a serious illness.
Yes.
So, when should we visit a doctor?
Usually it is a self-limited acute respiratory illness, but in some children, especially in high-risk children, as I mentioned earlier, they may have gone for some serious complications. So, symptoms are respiratory distress, become blue in color. So, seizures, meningitis problems, headache, and rash, fever with a rash, and these kinds of problems may have gone for altered sensorium. These symptoms appears, the children may immediately seek hospitalization and seek for expert management.
Okay. Doctor, can we manage flu? What are the measures to be taken to manage this influenza?
Flu is a respiratory illness. It is primary modality of management is symptomatic management. That is for, as I told you earlier, the symptoms of common flu are fever, sore throat, headache, coughing, etc. Fever is managed by simple antipyretics. It's like paracetamol, brufen, etc. And for the coughing, oral rehydration. Oral rehydration is the main, fluid therapy is the mainstay of treatment. Adequate hydration is needed for the child. So, it will relieve the airway irritation caused by the coughing. And for the nasal discharge and all, you can use the nasal drops, nasal sprays. And as I told you, the hydration, adequate oral therapy. And sore throat, you can use warm saline gargle, sipping of the warm water. Even honey can be used for all the children for more than 1 year. Yes.
These are the home remedies, some of the home remedies you suggest?
Yeah, some of the home, these are the home remedies for simple flu illness, uncomplicated flu illness.
We know flu spreads from one child to another.
Yes.
So, can we prevent it? Because especially during the school days, we know when the schools open, flu is very common.
Yes.
Can we prevent influenza? What is your suggestion?
Yeah, flu is a preventable disease. Flu can be prevented by hygienic measures. The primordial prevention management is hygienic measures. Follow the hygienic measures. Simple hygienic measures like during covering with your elbow or hands, and for sneezing, covering with your elbow, hands, or using towels or kerchiefs and tissues, or for the, if your child is sick with this flu, if it's simple flu, please don't allow to go to school, because the other normal children may get easily from your sick child. So, it is better to avoid going to the school for at least 24 hours fever-free period. So, avoid contact with the sick child is the main management of the flu, simple flu. For the other way of prevention is, as you all know, there is flu shots available in the market, in the hospitals. Flu shots contains different types of vaccines, killed vaccines, live vaccines, and killed vaccines contains IM injections, and live vaccines spray, nasal sprays are available. For the vaccines, we have to take vaccines before the onset of the winter period, that is before the October end. At least 2 weeks is needed for the antibodies to develop. If you get the flu shot, 2 weeks is needed to develop the antibodies. So, before the onset of winter period, you have to take the vaccines. Whether it is killed or live depends on the availability, depends on the state of the child. And the one thing you have to remember is, if you are taking the child for the first time, you have to get the flu shot for 2 doses before less than 8 years, 1 month apart. And the influenza virus has a property to change their strains annually sometimes. Even if you child get a flu shot before the last year, you have to take annual influenza booster doses, because it is because of the property of the influenza, the mutation comes. So, yes, vaccines are the methods to get the to prevent the influenza virus.
So, these vaccines we have to repeat every year?
Yeah. So, it is because of the strains, you know, strains or mutation occurs in strains. So, every year we have to take, both adults and children, every year we have to take the annual booster dose vaccines.
Doctor, another query from our viewers is antibiotics needed for treatment of influenza in children?
That is a good question actually, because influenza, as you know, it's a it's a viral disease. It's a simple acute self-limited viral disease. As such, antibiotics are not needed for the simple influenza viruses. But in some children, high risk children, immunodeficient children, cerebral palsy, neurodevelopmental problems, kidney transplant, and that type of children, chronic asthmatic children, may go for complications. So, they need, or sometimes they need hospitalization. Some children, that sort of children may have to give antiviral treatment, that is oseltamivir, antiviral treatment. But even after that, giving the antiviral treatment, sometimes they have a chance of getting secondary bacterial infections. For in those children, there is a chance that we have to give antibiotics.
Antibiotics for that.
So, whenever you get a flu, whenever a child get a flu, don't take it easily. I mean, it will go. Don't take it as simple. Especially if your children is in the high risk category, you have to consult. You have to seek the help of a doctor as soon as possible.
Doctor, what is your advice for our viewers who are parents of young children?
Flu is as I told you earlier, it's a acute self-limited respiratory illness. If your children are adequately hydrated, adequate immunity, good food, balanced diet, taking balanced diet, no need to worry. It goes by its own. No need of any antibiotics, no need of any antiviral treatment. It's a self-limited treatment. You can give supportive management for fever, paracetamol. For sore throat, you can give warm saline gargle, etc. No need of any antibiotics or antiviral treatment. But if your child is in the high risk category, they are having immunodeficient states, chronic asthmatic patients, neurodevelopmental problems are there, CP child, etc. In the high risk category, you should seek the help of a doctor immediately. You have to take the influenza vaccines annually. Not only decreases the vaccine, not only decreases the getting influenza infection, it also decreases the possibility of getting serious complications also. Sometimes if even your child take the influenza vaccine, your child may get chance of getting a chance of mild flu infection, but it decreases the chance of getting serious complications later.
And finally, doctor, what do you have to say about Al Hilal Healthcare? What are the services you offer at Al Hilal Hospital, Hamad Town, especially in your department?
Al Hilal is a leading healthcare management team in Bahrain. Altogether, we have 9 branches. Main mottos are affordability, accessibility, and availability. I am working in the Al Hilal Hamad Town. Although I am working in the Al Hilal Hamad Town, my time period is 9 to 1 and 5 to 9. We are seeing the patients from the periphery. We are assessing the children from the periphery, and if the children is complicated, any complications or any problems related to flu virus or any diseases, we will refer to 24-hour facility, 24-hour period, doctors available period facility, and altogether we giving a team coordinator teamwork for the sick children.
So thank you, doctor. Thank you for joining us and giving us a lot of information about influenza.
Thank you so much.
So viewers, I hope this episode was very informative, and for more informative episodes, tune in to BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasseela Mujeeb signing off. Good night.